Hello, I'm Dr. Frances Pitsillis. How can you help female sexual response? Well, everyone wonders about that. It seems to be that the female sexual response is the first to go when there's any stress, and the male sexual response seems to be the last thing to go when there's any stress or disease. I can imagine you nodding sagely as you hear about this, and we all know that there is already a libido or sex drive gap between men and women generally, but what can be done? There is much research and discussion about men's hormones, especially testosterone, but not a lot about women and their sexual needs. At one time, it used to be, there, dear, it's all in your head. But now there's recognition that the female sexual response is indeed a complicated thing, as many men will tell you. It is wide-reaching, multifactorial, and involves psychology, social factors, brain neurotransmitters, and hormones. One definition of this problem is hypoactive sexual desire disorder. And the definition of this is a persistent and recurrent lack or absence of sexual fantasies and desire for sexual activity that causes marked distress or difficulty in interpersonal relationships. So what they're saying is you don't feel like it, but it causes problems for you. If you don't feel like it and it doesn't cause any problems, it's not a problem. So in this situation, women may take a bit longer to warm up and perhaps don't get the response that they used to get. So often women are reluctant to bring up the topic with their doctor, so the figures I'm going to give you are estimates and they're probably underestimates. But depending on what your estimate is, it's thought to affect 20 to 50% of women. And it definitely has an issue after menopause, and especially in women who've had a surgical menopause, because the ovaries are removed and they make most of the woman's estrogen and testosterone. Once women are aged 50 to 70, the rate is about 9% and 12% if they've gone through a surgical menopause. So the problem seems to get worse with age. Now, the symptoms of this condition are that women have little desire, little arousal, and even pain. And these are associated with negative feelings towards the sexual act, as well as their own physical and sexual satisfaction. As already mentioned, there are numerous factors that are associated with all of this that intermix. Foundationally, what are the dynamics between the couple? How are they communicating? How's the relationship progressing? Newer relationships have fewer problems. Women who've had a relationship longer than 20 years have more problems. Has the woman got any mental illness? If she's more anxious, there's going to be more problems. Depressed women just have no motivation. So, and also the neurotransmitters are altered in anxiety and depression, and they affect mood, libido and responses, including the climax. Age, as women get older, they find that their hormones are declining and it's natural for them to lose interest and response. But in addition to that, when women are losing estrogen, their vaginas become drier and there's less lubrication, which causes quite a few problems. Pregnancy is a special time when desire drops, especially during the third trimester, and this can last for 3 to 6 months after delivery, especially if the woman is breastfeeding. And what if she's had a painful vagina after the birth? Or there's problems with her pelvic floor after the birth. Now, sex hormones have a very important role in all of this. What happens is that the initial sexual stimulation causes a release of a blood vessel dilating substance called nitric oxide, and that's the same as in the male. In the female, it causes lubrication and congestion of tissues, and in the male, it causes engorgement of the penis. In addition, at that time, there are messengers in the central nervous system, the brain and the spinal cord, that will be influenced by the nitric oxide. And then the nitric oxide increases a substance called cGMP. And that's the same thing that Viagra-type pills stimulate. And that's all part of the response. Estrogen and testosterone are known to increase nitric oxide. And so this is where the hormones come in. And in women, they need a minimum amount of these hormones to get that sexual response. What are the causes of low testosterone in women? Age, removal of the ovaries, which make testosterone and estrogen, but also testosterone comes from the adrenal glands. So if the woman's worn out, she's going to have less testosterone from that. Are there problems with the hypothalamus in the brain? Are there problems with the pituitary, which is underneath the hypothalamus in the brain? Is there some adrenal problem, which is a gland that lives on top of the kidney? And it can be from a tumour, disease or stress. Is the woman on synthetic steroid therapy? Is the woman on estrogen therapy? So this could be why the contraceptive pill can have an effect, because when you take estrogen, it increases sex hormone binding globulin and it mops up testosterone and the other androgen, DHEA. Does she have an overactive thyroid? Is she depressed, or does she have cancer? Now, if we move over to the neurotransmitters, the chemical messengers in the brain, dopamine is a pleasure chemical in the brain and increases sexual desire and the sensation of arousal and the desire to continue sexual activity once stimulation has begun. On the other hand, serotonin, another neurotransmitter, inhibits sexual response. So there's a balancing effect, and we know that serotonin is enhanced by some antidepressants. So you can see why some antidepressants reduce sexual interest. Now, both of these neurotransmitters are also affected by stress and deficiency, because you need an adequate diet, adequate digestion, zinc, vitamin C, B vitamins, magnesium, etc., to make all these neurotransmitters down the track. And so if there's disease or deficiency, you can see how they'd be affected. And fish oil also helps to improve dopamine. Well, it makes sense that one of the things that women in this position should do is take a multivitamin, vitamin C, fish oil, and then correct any other imbalances. Selective serotonin reuptake inhibitors like fluoxetine, Prozac, and their cousins influence serotonin, as do other antidepressants. I've already mentioned that. Now, other neurotransmitters that affect sexual desire include oxytocin, which is released during breastfeeding and also released during lovemaking. It increases a sense of bonding. Prolactin from breastfeeding and opioids, morphine-type substances, can inhibit desire. So when you've got prolactin, when you're on narcotic painkillers, you're not going to feel like sex. So there's a whole lot of questions that women are asked to help experts determine where their problem's coming from. And the sort of questions that they're asked is, what was your interest and level of satisfaction previously? Has it changed now? Does it bother you? Would you like it to be better? And are there factors like operations, depressions, injuries, medical conditions, medications, pregnancy, childbirth, menopause, problems with your partner, dissatisfaction with your relationship with your partner, or stress and fatigue? Now, what can help you with your sexual interest and response? Apart from nutritional, diet and lifestyle, dealing with stress, correcting hormone imbalance, we're looking at counselling, especially if there's relationship or social issues, getting a good night's sleep, In my view, you need a harmony of your hormones. It's not just about giving women testosterone, it's about harmonising estrogen, testosterone, progesterone, DHEA. And in fact, before I give women testosterone, I prefer to give a correction to the DHEA levels, because DHEA is a safe way of supporting women, and women get a lot of their testosterone from DHEA. My research suggests that this type of therapy, hormone therapy, is safe. There's no increase in heart disease or changes in blood pressure. In fact, DHEA protects the heart. And androgens don't stimulate the lining of the uterus. And this is why I recommend that if this is part of your problem and you feel you need to look at correcting your hormones, that you seek a doctor who understands how to safely correct hormone imbalance. So it's not in your head. It could be stress or too much work, fatigue, juggling many balls and being a superwoman. And on top of that, it could be nutrition and hormones, especially if you've been sick or on drugs, gone through the menopause, had a baby, or had gynecological surgery. So make a start now. Get your fundamentals right and seek out someone who knows what they're doing with the hormones.